Good morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine and Principal PKDAS Institute of Medical Sciences. In the last session on motor system, we have discussed the motor planning and how an action is carried out. And we have discussed about the corticospinal tract. Today I will be discussing about the extrapyramidal tracts. What do you mean by extrapyramidal tract? The tracts which are descending down, not passing through the pyramids, that is medullary pyramids, are called extrapyramidal tracts. So the human descending tracts can be divided into the pyramidal tract and extrapyramidal tract. Some of them are crossed and some are uncrossed, and depending upon the position of these tracts in the spinal cord, we can divide them into a medially situated and laterally situated tracts. And here you can see the corticospinal tract arising from the brain. The somatotopic representation has been discussed. It is descending down, passing through the internal capsule and descends down, and at the level of medulla they cross over to the opposite side and supply the anterior horn cell. So from cortex to the spinal cord is corticospinal tract. Some of these fibers are relying on the motor neurons of the cranial nerves. They are the corticobulbar tracts. Now the extrapyramidal tract, as mentioned, they are not passing through the medullary pyramids. The main ones are, one is arising from the tectum, that is the superior colliculus in the midbrain. They are called the tectospinal tract. In the red nucleus of the midbrain, that is the rubrospinal tract. When the pons and medulla in the reticular formation is there, from their tracts are descending, they are the reticulospinal tract. And from the medial and lateral vestibular nuclei tracts are arising, they are the vestibular nuclei, vestibulospinal tract. So these are the major extrapyramidal tracts. They have got connections from the basal ganglia also, and that is why they are important in the extrapyramidal lesions also. So now we think about these tracts, which are the crossed ones. So already mentioned, from the tectum, that is superior colliculus, the pathway is crossing to the opposite side and descending down, that is the tectospinal. So it is a crossed tract, and the crossing is called the dorsal tegmental decussation. And next tract is the rubrospinal. From the red nuclei, the fibers are passing down and crossing to the opposite side, that they are the rubrospinal pathway. And from the reticular formation in the pons and also from the medulla, pathways are arising. The pathway arising from the pontine reticular formation descends down without crossing. They are called the medial reticulospinal tract. And the arising from the medulla is called the lateral reticulospinal tract. The lateral reticulospinal tract is crossing to the opposite side, some of the fibers, and some are descending down ipsilaterally. So the major crossed pathways are, one is the tectospinal pathway, rubrospinal pathway, the corticospinal pathway, and the medial or pontine reticulospinal pathway. Then which are the uncrossed ones? From the lateral vestibular nuclei, fibers are descending down. This is an uncrossed pathway, that you should remember. Then of course the anterior corticospinal pathway, that is 90% of the corticospinal pathways, 90% is crossing to the opposite side, 10% is descending down, and they are the anterior corticospinal tract. They are uncrossed fibers. Among this 10%, only 2% relies on the anterior horn cells of the same side. Others are also crossing to the opposite side before relaying. Then we have also mentioned about the pontine reticular reticulospinal pathway, that is the medial reticulospinal pathways are again uncrossed. So these are the uncrossed pathways. So we have so far discussed about the crossed pathways, uncrossed pathways. Now depending upon the position in the spinal cord, you draw a cross section on the spinal cord like this. So you can see that in the cross section, the lateral corticospinal pathway and the rubrospinal pathway, they are in the lateral part of the spinal cord. So they can consider them as a lateral tracts. In the anteriorly in the medial part, you can see the anterior corticospinal tract, that is the uncrossed corticospinal tract. Then the tectospinal pathway, the pontine reticulospinal pathway, that is the pontine reticulospinal or the medial reticulospinal pathway. So they are on the medial part. Then there is a vestibulospinal pathway and the medullary reticulospinal pathway. These are situated medially. So this is how you group the tracts. So to recap, the crossed fibers are the corticospinal, that is the lateral corticospinal, tectospinal, rubrospinal, the medullary reticulospinal pathway and the medial vestibulospinal. So remember these three, these are the important ones. Then the uncrossed one, very important, the pontine or medial reticulospinal pathway, the vestibulospinal, especially the lateral vestibulospinal pathway and the anterior corticospinal. These are the uncrossed pathways. So this is shown this picture. So here remember the lateral corticospinal and the rubrospinal are the lateral pathways, others are the medial. Then coming to what are the functions of these tracts. So the distal fine movements, that is the corticospinal. So when there is a dysfunction of the corticospinal tract, the distal fine movements, as example the hand movements, that is what is mainly affected. Then something comes into your visual field, you want to look at that. For that the neck muscles has to be activated. The tectum or the superior colliculus has got connections on the visual pathway. So the tectospinal pathway is concerned with the neck movements. It is easy to remember. So when you are looking at somebody, the neck is moving. It is through the tectospinal pathway. When you are doing an action, for example, you are going to catch something, your proximal muscles has to be stabilized, and the maintenance of the tone of these muscles are mainly by the vestibulospinal and the reticulospinal pathways. The pontine reticulospinal pathway, that is the medial ones, are mainly for the flexor muscles they are acting on, and the medullary reticulospinal are on the extensor muscles. So they are mainly for the control of the proximal muscles. We will discuss regarding the dysfunctions of these when you discuss about the muscle tone. So here this is the vestibulospinal pathway about which we have already discussed, that is for the proximal muscles maintenance of the tone. We require this reticulospinal pathway and the vestibulospinal pathway. So in the last session we have discussed the difference between LMN and UMN lesions. So to recap again, the LMN lesions are either in the anterior horn cell, the nerve or muscles. The UMN lesions are in the brain or spinal cord. There is hypotonia, hyporeflexia, there is no Babinski sign, fasciculations and muscle atrophy. These are the cardinal features of the LMN lesion. And in the UMN lesion, exact opposite, you get a spasticity, hyperreflexia, the Babinski sign or extensor plantar, there are no fasciculations. Sometimes you may get a dystonia and disuse atrophy, no significant wasting. So we have discussed the descending tracts, that is both pyramidal, extrapyramidal, what are their main functions, and the few words on the difference between UMN and LMN lesions. In the next session, we will be discussing clinical localization of UMN weakness and also what is the pathophysiology or what is the basis of the physical findings like extensor plantar, the hyperreflexia and hypertonia. Hope this video was useful to you, and if you like this, please subscribe and share this video. Thank you.